Andria Borba's in San Francisco. She got a look inside the special negative pressure rooms hospitals use to isolate viruses like these. Andria?
Well, Alan, these rooms could become vitally important with community spread of the coronavirus, an important resource and asset to isolate those patients with severe cases of coronavirus.
Behind these two doors is one of 100 rooms in San Francisco that could help stop the spread of coronavirus if seriously ill patients need to be hospitalized. It's called a negative pressure room.
Air flows from the hallway into the anteroom rather than flowing out into the hallway where there are other people.
Beyond the hallway, there's a room where only necessary medical personnel would put on their equipment.
A respirator, which looks like a mask, we call those N95 masks. They'll put on eye protection, either a face shield or goggles. They'll put on a gown and they'll clean their hands and they'll put on gloves.
From there, doctors and nurses would go into the room with the infected patient.
And when you come through the second door, you're in the patient's room, and this room also has negative pressure with respect to the anteroom. So the air is flowing into this room, not out of this room.
Dr. Lisa Winston is the hospital epidemiologist at Zuckerberg San Francisco General. Her job is controlling infectious diseases. Negative pressure rooms are typically used for patients with tuberculosis, measles, and chickenpox, but will be used for patients who contract the novel coronavirus.
Well, it's certainly important that it not spread because we know that it can cause people to get quite sick, and so it's a new disease. We don't have immunity to it. We don't have a vaccine for it yet.
Now, there are not a lot of these negative pressure rooms throughout the Bay Area. There are 100 here in the city and county of San Francisco, spread throughout all of the hospitals in the system. Zuckerberg San Francisco General has about 50 right here on this campus, but throughout the Bay Area there are only around 200. Not a terrible lot. Live at Zuckerberg San Francisco General Hospital, Andria Borba, KPIX 5.